Everyone, this is your beloved Sonal, and I'll take the liberty of assuming that you do love me. Welcome back to my channel. If you're new here, I post random videos about fun, art, photography, and whatever else comes to my mind. So don't forget to hit that subscribe button. And I don't really have a very streamlined posting scenario going on here, so when I drop the bomb, you'll be the first one to know because I'm pretty sure you have turned on the notification icon as well. So, before I get started on the video, there are a couple of announcements that I need to make. And the first announcement, well, it's not really an announcement. The first bit is for the guy that I dated when I was 16. So the last time I posted a video on my channel, this is what happened. Uh, Feel free to pause the video and read through, but yeah. And while I do take feedback very generously, I certainly do not tolerate shit from people who do not move a finger. So while I cannot really control how high or how low my voice can go, I have a special something for my dear feedback giver and my constructive criticism giver. And if you're watching this, then this one's for you, honey.
Can you hear me?
Am I loud enough?
Hello? Is this loud enough? Am I audible to you?
Hello, can you hear me?
The second announcement is the disclaimer that I used before the video started, which I'm pretty sure a lot of you must not have read because kaun hi padhega. So yeah, as the video title suggests, this is a mental health FAQ video, and note that I am not a professional, not a therapist. I do not receive counseling myself, even though I face mental health issues. I'm just a regular person. But these are very commonly asked questions that people come up to me with, or I have read on the internet over the years. And having said that, if you feel that you need professional help, please consult a therapist, psychologist, psychiatrist, whatever suits you, and do not rely on this video alone or any video that you might find on the internet which is uploaded by a regular person. If you need professional help, please seek it. And let's start the video. The answer to this is as simple as anything can get, but to specify health in any form is important. When we fall sick, when we have really bad physical habits, or we just want to improve the way we look, we start taking care of ourselves. But then that's just the physical aspect of our being. What we often fail to realize is the fact that we also need to take care of our mind and our mental peace. And what we don't realize is that without a properly functioning mind, the body too won't function any better over a course of time. Think of it as this way, when you feel that you're failing at something or you're not good at something, you start looking up for ways to help you improve in that area, right? Similarly, when it comes to mental health, it is really important to understand and accept the fact that you need to get better, and for that, you need help. Now, there are a lot of ways in which you can seek help. For example, if you're someone who finds it really difficult to open up while talking to people, you can start talking to people you feel comfortable with, or someone you feel would actually understand what you're going through or what you're dealing with, and not give you shitty advices like calm down or don't overreact or this happens with everyone and all that shit. Now, the next thing is to see if you want to visit a therapist or a psychologist. The main thing here is to understand the difference between a therapist and a psychologist. A therapist is someone who has a certain level of training in a particular field, such as addiction therapy or trauma therapy, behavioral therapy. A psychologist is someone who has a master's degree or a PhD degree in psychoanalysis, and they will actually help you diagnose the disorder that you're going through or the mental health issue that you're dealing with. Now, if you think that neither of them are able to help you out and you need proper medication to cope up with your mental health issue, the person you're looking for is a psychiatrist. A psychiatrist is an actual medical doctor and they solely hold the power to prescribe you medicines. Note that a therapist or a psychologist cannot actually prescribe you medicines, so if you find them doing that, please consult a psychiatrist first. A lot of times, when people come up to us and try to communicate about how they're feeling or what it is that they're going through, we often downplay their emotions by asking them to calm down or to not overthink, both of which are really bullshit solutions. So, if you really want to help someone, the most important thing to do is to just listen, to be there and listen. Now, the most common misconception all over the world is that people having anxiety and or depression walk the planet with sad, droopy faces, projecting their sadness onto other people. Unfortunately, it is not that easy to just look at a person and label them as anxious or depressed. More often than not, they seem pretty fine on the outside, and it isn't until something really bad has happened that we come to realize that uh, something is wrong with them or something was wrong with them. But there are certain behavioral changes that you can look out for if you want to help people. Some of them are prolonged fluctuations in the sleep pattern, the weight, appetite, concentration levels, feeling constantly restless, having morbid thoughts, uh, and staying cooped up in the house pretty frequently or for a long time, to name a few. So, if you are facing, or if someone you know is facing any such behavioral change for a prolonged amount of time, it is very important to acknowledge them at the very earliest. This is one question that I'm asked really frequently, and my answer is almost always the same. What works for me may not work for you, and vice versa. And it is important to understand that the intensity of a panic attack is different for different individuals. In fact, the intensity of your last panic attack might be very different from the intensity of an attack that you might be facing right now. So, that is something that you need to keep in mind. Now, one solution that does work for everyone is taking deep breaths, but what you need to do is form your own synchronized breathing pattern. So when you're facing a panic attack, you can use that pattern to take your deep breaths to bring you to a peaceful state of mind as fast as possible. Do not change your positions when you are going through an attack. That is only going to agitate you more. Focus on an object or a memory which brings you peace. Again, remember that you don't need to think really hard about that object or that memory, because if you need to think that hard, it probably does not make you that peaceful as you think it does. try to counter any negative thought that might be running in your head at the moment. Of course, I know it's easier said than done, but taking that first step is really important. And it is really necessary to understand what coping mechanism works the best for you, because while an outsider might try to help you when you're going through a panic attack, it is you who needs to fight it and fend for yourself. Trying to answer this is like trying to answer anything that lies on a really broad spectrum. You cannot just pinpoint as to what specifically causes depression, but there are certain factors that lead to the onset of depression, such as heredity or trauma of some sort, uh, certain medical conditions, and the use of medications, uh, hormonal imbalances due to the brain's reception to a particular issue, or relapse to or withdrawal from drug usage, and these are just a few of them. Know that a depressed person does not exude a sad aura or a negative aura. You would not have guessed that Chester Bennington was depressed just by looking at him. What you can do is you can just be there for people when they are trying to open up to you, because honestly, it takes a lot for many people to trust someone and open up to them about their issues. So, when someone does that, please listen. You don't have to necessarily advise them, but just listen. Alright, so that was it. That was the little knowledge that I have about mental health that I tried to share with you people. I'll be making a second video soon. If you think that you learned something from this video, or someone you know might learn something, please leave a like. And if you want to help someone out, share the video with them. And if you have some questions, you can drop a comment below, or you can reach out to me over Instagram or my mail. And yes, please subscribe to my channel. I'm a very hardworking person. I'm lazy, but I'm hardworking. And last time I asked for 100 subscribers, चूतिए 89 लोग हो गए. I mean, I understand that you guys are my subscribers. I shouldn't be abusing you, but assuming that we are friends, I still hold the right to abuse you. So please subscribe. Please ask your friends to subscribe. I mean, you're losing out on quality content. Please. And is there anything else I want to say? Yeah, I'll be leaving my social details below. So if you want to hit me up, you know where to look for. And yes, please subscribe. इतने बार subscribe बोलने में शर्म आती है, but I'm बेशरम, so see you next time whenever that is. Bye. Hey everyone, welcome back to my channel. This is Sonal, and I forgot my dialogue. Hey everyone, this is Sonal, and welcome back to my channel. Uh, hey everyone, this is your beloved Sonal, and I'll take the liberty of assuming that you do love me. Welcome back to my channel. If you are new to my channel, that's too many channels in a very short time. If you're new to my channel, then I post random videos about art, photography, general fun stuff. So before we get started on the video, there fuck. So So before we get started on the video, there are a couple of वो क्या रहा है? मर रही हूँ क्या?